federal government says no fewer than 37,000 jobs will be created in the geriatric senior citizens care industry being set up by the National Senior Citizens Center. The Director General of the center, Dr. Omakaro, stated this while assessing the impact of President Bola Tinubu-led administration in geriatric social care sector in his 1 year in office. Omakaro said NSSC had been able to build a system of caregiving for older people as a skill in the fields of health and social care. Omakaro said for the first time in the history of Nigeria, a document has been developed by the NSSC to bring sanity into the field of geriatric social care. Omakaro disclosed that NSSC has set up a private sector-led 23-member council made up of all relevant stakeholders in the field of geriatric social care to address the employment needs of the sector.
So in the field of health and social care, what we have done and accelerated is that we have been able to now start brick by brick, to build a system of caregiving to older people as a skill. You know, before now, it was family is there, family can care. So anybody could be left, anybody that was available in the family, whether the person knew anything about old age or knew anything about care or even knew anything about the multi-morbidity, chronic health situation of older people or not, that person would be there to just care. But what we did in this 1 year is that we worked very closely with NBTE as a regulatory body for technical education, and we're able to cause caregiving to be seen as a skill, and then to be integrated into the Nigerian Skills Qualification Framework. That meaning that geriatric social care now has been seen as a sector skill, which means that carers of older people must be trained and must be certified. So for you to say you want to train and certify a caregiver, it meant that NSSC now had to work with every stakeholder, and when I say every stakeholder, not one was left out. Every stakeholder in the field of geriatric social care. Professional associations in aging, Geriatric Association of Nigeria, Gerontology Association, Association of Social Work in Nigeria, National Medical Therapists Regulatory Board, name them, social work educators, medical social workers, and then all the other associations, Older Persons Association. We brought everybody together, research and academia, to now develop the National Occupational Standards. The National Occupational Standards in geriatric social care means the national benchmark and minimum standards for training and certifying older persons. I can show you the document for the first time in the history of this country was developed. So now for you to care for an older person, you get certified. And of course, you know that most Nigerians who leave the shores of this country, they are going to work in the field in the care industry. And most of them get there and they are stranded. And because NBTE is a regulatory body and National Senior Citizen Center is the awarding body, it means that we have now brought, within this 1 year, sanity here into this field. And then another thing that we did was, within the Nigerian Skills Qualification Framework, now there is a demand that you must set up a geriatric social care sector skills council. Just like you have councils in other professions. You have Koren. There was nothing in this field at all. So now we have a council that was inaugurated. And the council is a 23-member council and is made up of all these very relevant and very significant associations in the field of geriatric social care. And it's private sector led. because it has to speak to the employment needs. If you are developing the skill, you must align it to the needs in that industry. And then apart from the council, another thing we have achieved is that we have identified and approved training providers. So who are the people that will be providing this training for the certification that we are talking about? So first and foremost, we had to consider, now this is beginning anew in Nigeria. It's a new sector totally. So we want to begin with the highest standard. So we're looking for training providers that have the multidisciplinary capacity, because issues of care crisscross, intersect, sociology, psychology, gerontology, name it, up to medical therapies, cognitive therapy, speech therapy. So now, we now identify that it has to be the state and federal university teaching hospitals that have geriatric units or geriatric center. Because if you are training in skills, you have to have the capacity to impart that vocational, that skills training. And 70% of this is practicals. And so yes, we're able to identify 22 states and federal university teaching hospital spread across, I think 21 states, because there's a state that has more than 2 training providers. Yes, and this is just the first batch. So what we have achieved is that for the first time in the history of this country, and that credit goes to this administration, because it's happening under the purview of this administration, is that Nigeria has just opened a geriatric social care sector, a subsector. And when you train and you certify, it means that these people have the skills to go into the market, the job market. And then you ask the question, so where are they going to work? I want to tell you that this National Occupational Standards has 5 levels of certification. The basic care level, that you can send your brother, sister that is in the home once you are 18 years and you have the NSSC certification, you can speak English, you can write, get the basic training. So it's actually left out. And then you have the level 2, you have the level 3, you have the level 4, you have the level 5. So 3 to 5 now has been integrated in the Federal Civil Service cadre for employment. So that is what this agency has done.